Ladies, welcome back. We are going to be talking about something almost all of us go through as we age, but nobody brings it up at brunch or ever. It is Genitourinary Syndrome of Menopause, also known as GSM. Think about it like your entire downstairs area is putting up a sign says we're closed for a renovation and things will just start changing. It sounds very dramatic, but don't worry. We are going to talk about all of it and maybe we'll have some fun with it. So, what is going on? It basically all comes down to hormones. As we go through menopause, estrogen starts dropping, and as we age, same thing, androgens like testosterone tend to drop slower than estrogen, but they drop too. So I want you to imagine these hormones as your personal construction crew. They help with building up everything down there. So your vaginal and vulvar tissues, they start getting thinner as those hormones go away. They lose elasticity, and that nice stretchy feel kind of goes away. Things are not moisturizing themselves anymore. So basically, what was nice and soft now starts feeling like horrible sandpaper. And it's just not just one hormone. These both hormones take care of different things. So, for example, estrogen keeps the pH of the vagina acidic. So a low pH is what we want, and that can help the good bacteria survive in your microbiome to stay healthy. So estrogen plus androgen or testosterone, they're like a tag team together. They keep the lining strong and the blood flow healthy. Think of them as kind of like the maintenance crew. And then the androgen's secret power help your vaginal wall contract. They support collagen and keep those nerves ending happy. So, what does all this feel like? Well, the symptoms that you might recognize will be vaginal dryness, burning, irritation, feeling like you have to pee all the time, recurrent UTIs, pain with intercourse, drop in libido, arousal, and orgasms. And this is not in your head. It's hormonal and it's absolutely fixable. So, who is the hero in our story? Well, basically, topical vaginal estrogen or estradiol. This estrogen is placed right where it's needed. So, it's topical, it's not absorbed throughout your whole body, and it's just local. If you've had breast cancer or you're worried about it, then there was a major study that showed that there's no increased risk in breast cancer, specific mortality with vaginal estrogen. Some studies even showed a slight decrease. This is just incredibly reassuring for so many women. We can also add DHEA or the testosterone side of things, where it's especially beneficial for the area around the vaginal opening, the vulvar vestibule, which is very sensitive to estrogen and testosterone. So, what options do we have? So we have quite a few depending on your budget and what you like. It's a very personal choice. All right. So let's talk about treatment options. What options do we have? We have a few, but I would say that they depend on your budget and your lifestyle. Option number one, it is a vaginal cream. It is the most budget friendly. In my office, for my cash patients or members, they pay around $13 per tube. One tube will last 2 to 3 months, which is an amazing value. And then we have for the patients that don't like the cream because they feel like it's too messy or they don't like to place it, etc. There's a million reasons why you might not like it. There are vaginal tablets, like inserts. They are a little bit more expensive. They're around $57 for 18 tablets, which is also about 2 to 3 months of the treatment. Then we have also a vaginal ring called S-string. That is kind of a branded option. So we know it's going to be more expensive. The nice part of it is that you insert it once and it releases estrogen for 90 days. And it does cost around $500, but it's very convenient for some women. So they are okay with paying this cost, or sometimes it can be covered by your insurance. And sometimes they also have kind of like this cards with discounts that you could use and make it a little bit more affordable. Option number 4 is called Intrarosa or DHEA, which is that testosterone side of things. That one is used nightly with insurance and can be around $85 at Costco. Cash patients pay up to $260. So they start getting more and more expensive as we go. And then the last option we have is the ospamifene. It is an oral tablet, non-hormonal treatment, and we mostly use it for painful intercourse. It is systemic since it's a tablet, but it is a great option for some women, and is also a little bit more expensive, but you can find it with saving cards on their website, and the cost can drop all the way to like 35 to 95. So those are the treatments for GSM. It is very common and is very manageable. So we all deserve to be comfortable and confident in your own body. You don't have to suffer in silence. Please talk to your doctor, ask all your questions, explore your options. If this video helped you, please hit that thumbs up, share it with a friend, and subscribe. Tell me what topic should we dive into next. Let me know in the comments. And if you have any questions about GSM, how to treat it, or any questions about side effects or how to use them that I might have missed, please write it in the comments. I'll be happy to answer. Bye.